Welcome to the University of Tennessee Joint Replacement class. My name is Kiki McKissick, and I'm the Orthopedic Coordinator here with the UT Advanced Orthopedic Center. And today, I'm going to be talking to you about your total joint replacement. Our goals for the class is to give you an overview of your hospital stay, help prepare for your surgery, help plan your recovery, ease your anxiety, and to answer any questions that you may have. Our mission is to provide a joint replacement destination center that guides patients through a superior patient experience and long-term functional success through safety, quality, and patient-centered care. Our philosophy: the foundation of our program is patient education, wellness, early mobility, and returning back to independence. Our objectives: continually improve patient safety and care using clinical practice guidelines. Remember, your joint is sick and you're not. Let's talk about preparing for your surgery. Plan to have someone stay with you the first week or so during recovery. Make a path wide enough in your home for a walker. Remove any obstacles that can cause you to trip, such as rugs, cords, and be mindful of little pets. Pick a safe area in your home to sleep. Have ice packs readily available. Have any assistive equipment available if needed. Here's a list of durable medical equipment that you can purchase prior to your surgery: shower chair, a tub transfer bench, elevated toilet seat, and a bedside commode. Strengthening your muscles before your total joint replacement is an essential part of preparing your body for surgery and the recovery process. When your muscles are stronger, you will be able to recover more quickly. Leg exercises will help your non-surgical leg support you and will help your surgical leg recover faster. The arm exercises will help build strength to help you use a walker, crutches, or a cane. If any of these exercises aggravates your condition or any other injuries you have, discontinue the exercises. Remember to breathe through the exercises. Exercises should be performed 3 times a day, starting with 10 repetitions each and gradually working up to 20 repetitions each. These exercises are located in your joint guidebook. As you continue to prepare for your surgery, remember you will not be able to drive until given permission by your orthopedic surgeon. So plan to have your coach available to run any needed errands and to get you back and forth to your follow-up appointments. Think about your home medications before your surgery and get refills before you run out. Think about your meals. Do you need a meal plan? And you may want to go to the grocery store and get the basic staples a few days before your surgery. Basic staples such as protein, leafy green vegetables, and fruit. And I want to encourage you to try to intake at least 8 ounces of water a day. Prior to your surgery, you will go through the PAT process or pre-anesthesia testing. Pre-anesthesia testing is a medical clearance process provided by UT Medical Center to assess patients before undergoing anesthesia. In PAT, they will do a medical history review. They will let you know what medications you need to stop before your surgery, and they also will let you know if there's other tests that's needed before your surgery. Let's talk about preventing infection. The way we prevent infection is by using the chlorhexidine or the CHG soap 3 times prior to your surgery, using an alcohol-containing antiseptic agent for preoperative skin preparation, giving antibiotics before, during, and after surgery, and also giving a 3M nasal antiseptic swab in a preoperative holding area. The 3M nasal antiseptic swab is to treat Staph aureus. 25 to 30% of the population are carriers of Staph aureus. Less than 2% are colonized. Staph aureus, or MRSA, is commonly found on the skin and in the nose. You will receive the 3M nasal antiseptic in the pre-op area prior to your surgery unless you have an iodine allergy. Please note, this can cause the skin around your nose to be orange. Now let's discuss how to use the CHG soap. Start using the soap 2 nights before your surgery and the morning of. Wash your hair and your body using your regular shampoo and soap. Rinse off. Turn the shower off or step away from the flowing water. Apply the CHG soap to your washcloth or sponge. and bathe from the neck down. Avoid your face and avoid your private area. Scrub your surgical area with the CHG soap for an extra 3 minutes. Rinse off with warm water and apply clean, dry clothes. Preventing infection. Be sure to keep your hands sanitized. Do not let your pets sit on your bandage or near your incision. Place clean sheets on your bed before you come to the hospital. Clean your sheets often. No pets in your bed during your recovery. I know we like to think our little pets are clean, but their little paws and booties can carry germs that we don't want near your surgical incision. Use clean towels and washcloth with each shower. Wear clean clothes and keep your incision clean and dry. There are some things that you should not do leading up to your surgery. Do not take blood thinners starting 7 days before your surgery unless otherwise instructed by a physician. Do not shave your legs 5 days before your surgery. It'll be okay to shave your face and your arms with a brand new razor. Do not wear lotion, powder, or deodorants on the day of surgery. The night before your surgery, try to rest as much as possible. Eat a decent supper. Take your nightly medications that you're instructed to take by pre-anesthesia testing, and take a shower using the CHG soap. When do you need to stop eating? Do not eat or drink anything after midnight the night before your surgery. This includes smoking, chewing tobacco, eating mints, candy, gum, or any type of food. This is for your safety. Your surgery will be canceled if you do not follow these instructions. The morning of your surgery, take a shower with the CHG soap. Take only the medications you're instructed to take by PAT. Do not bring any valuables with you to the hospital, and do not bring any of your home medications. Do not wear makeup, lotion, nail polish, contacts, or jewelry. The day of surgery, you will park in Parking Garage H. Parking Garage H is located across from the Fountain Circle entrance of the hospital. You will check in at patient registration. After you're registered, they will get you up to the pre-op area. In the pre-op area, you will hand over your glasses, hearing aids, or dentures, and we ask that you bring a labeled case. Label the case with your name and date of birth. In the pre-op area, you will have your IV started. You will receive your first dose of antibiotics. You will meet with the anesthesia staff to discuss your anesthesia options, and you will receive that nasal antiseptic swab. After you receive your nasal antiseptic swab, you will be taken to the operating room. After your surgery, you will wake up in recovery. After your recovery room, you will go to phase 2 recovery. At that time, your physician will let you know if you're medically ready to be discharged home or if you plan to stay overnight in the hospital. Discharge from the hospital. You will leave the hospital when you're medically stable and meeting your physical therapy goals. You will be discharged from the recovery room to the Fountain Circle entrance where your family can meet you to take you home. Ice therapy. Ice therapy is used to lessen pain and swelling. Ice numb nerve endings and decrease blood flow so it reduces swelling and help decrease pain. Anytime you have pain, you need to put ice on the site that hurts. This will help you not take too much pain medication, and it will also help you when you're weaning off your stronger pain medicine later at home. Total knee replacement will have a compression ice wrap placed on their knee. Total hip replacement will have ice packs placed over their bandage. After surgery, your nurse will teach you to perform deep breathing and coughing exercises, which will help prevent pneumonia. You will continue to do these each day after surgery. In addition to breathing and coughing, your nurse will teach you to use a breathing device called an incentive spirometer. This is used to expand your lungs and to help get oxygen to the tissues in your body. It helps to clear your lungs after receiving anesthesia, and it helps to reduce fever. It will also help with nausea and sleepiness. It is important to use your incentive spirometer 10 times per hour while you're awake. Your rolling walker. If you need a walker and you are discharging home, you will get a walker from the hospital. If you need a walker and you're going to a skilled nursing facility, you will get a walker from the facility. Please note, your insurance may cover a portion of this, but only if you haven't received one in the last 5 years. Pain management. You will have pain after surgery, and everyone's pain is different. Pain after surgery can be related to your incision or due to positioning and surgery. You may also experience muscle spasms after surgery on top and back of your thigh. If this occurs, let your nurse know, and we can order a muscle relaxer. Your nurse will have you rate your pain on a pain scale, a scale of 0 to 10, with 0 being no pain at all and 10 being the worst pain ever. Remember, communication is the key. Most pain medications are ordered every 4 hours as needed. Call your nurse and request pain medication if needed. Preventing constipation after surgery. Some of the causes for constipation is surgery itself, pain medication, and not moving around as much. Treatment for constipation includes stool softeners, laxatives, and drinking plenty of water. Taking less pain medicine can help lower your chances of constipation. Blood clot prevention. Some of the causes for blood clots are surgery and decreased movement. We can help prevent blood clots by taking the blood thinner medication, wearing your compression stockings, and just getting up and walking around. You'll have a few new medications at the time of discharge. We have an outpatient pharmacy that can help fill your medications before you leave. Please let your nurse know if you'd like to have your medications filled here at the hospital. Keep in mind, if you're from out of state, you will not be able to get your pain medications filled in your home state. They must be filled in the state the prescription was written in. The state of Tennessee has very strict laws that your surgeon must abide by when prescribing pain medication. There are restrictions on how much pain medication your surgeon can prescribe for you. These restrictions are determined by the state of Tennessee, your insurance company, your pharmacy, and not by your surgeon. Please discuss with your surgeon if you have any questions regarding your prescriptions. Physical therapy prescriptions. If you're going to outpatient physical therapy, be sure that you have a prescription for physical therapy before you leave the hospital. Take this to your first physical therapy appointment. This prescription is needed to bill your insurance. Toolbox for pain management. Pain medications that you may see during your journey is oxycodone or Percocet, tramadol or Ultram, hydrocodone or Norco, Dilaudid or Nucynta. Common nausea medications, Zofran, Phenergan, or Vistaril. Common nerve medications such as Lyrica or gabapentin. Other things that help manage pain after surgery. You can use ice therapy. Remember to apply ice to where it hurts. Try over-the-counter Tylenol. Remember, no anti-inflammatories such as Advil, Motrin, or Aleve until your surgeon instructs you to take them. Let's talk about how to take your pain medication at home. Take your medicine as prescribed, but also as needed. An example, take every 6 hours as needed for pain. This means to take pain medication when you start to hurt, but no sooner than the time on your prescription. Take for breakthrough pain. An example of breakthrough pain. If you take a pain pill at 8 a.m. and you can't take another until 2 p.m. and you start to hurt during this time, this is called breakthrough pain. Ways to manage breakthrough pain: ice therapy, Tylenol, and some physicians will order other medicines for breakthrough pain such as tramadol or Vistaril. Managing your pain at home. If your pain is a 4 to 6 on the pain scale, then you need to take something before your pain gets out of control. You do not have to set an alarm clock during the night. If you're sleeping, then your pain is considered to be under control. When should you wean off the stronger pain medication? Start to wean off of pain medication if your pain is between a 1 and a 3 on the pain scale. The ways to wean yourself off the pain medication is by spreading the time out between taking pain medication. You can cut your pain pill in half. Start replacing the pain pill with Tylenol. Do not stop cold turkey, and you can also use ice therapy during the weaning process. As you continue to recover at home, Remember to get plenty of rest. Keep your physical therapy appointments. Be sure to walk and perform your daily exercises. Continue your healthy diet, green leafy vegetables, protein, and remember to increase your water intake. Let's talk about your mood after surgery. Joint replacement surgery usually gives people movement and freedom, but keep in mind your body has been through a lot. It may take a while before you feel like yourself again. You may feel sad or upset. These feelings usually go away as you heal. Call a friend or family member to talk to. If you feel very sad, overwhelmed, or helpless, and these feelings do not go away for many days or weeks, please let us know so we can make sure you recover well. You will have follow-up appointments with your orthopedic surgeon. 2-week follow-up, you will have a 6-week follow-up, a 3 and a 6-month follow-up. The hospital may seem a little different due to the COVID-19 pandemic. You will now see checkpoints at entries. You will see staff in masks, and we are under visitor restrictions. Please call your orthopedic navigator with any questions that you may have during your recovery. The phone number is 865-305-8848. Lastly, thank you. Thank you for choosing the University of Tennessee Medical Center. We hope that you will recommend UT Medical Center to your friends and family.